This is an apical 5-chamber view, and this is an apical 4-chamber view. You can see 4 chambers, RV, LV, RA, LA, and the transducer location is here. And this is 5-chamber because in addition you are seeing the aorta also. Right atrium has not been labeled. In this view, you can see that mitral leaflets are thickened. This is the anterior mitral leaflet is thickened. And in the closed position of mitral valve, when there should be no flow to the left atrium, we are seeing a jet, a mosaic jet which has been traced out, multicolored jet due to high velocity and turbulence. That is what you are seeing here. This is the mitral regurgitation jet. Two things which you look at regarding the jet are the extent to which it is extending into the left atrium. It is extending almost the whole extent. And the area of the jet compared to the area of the left atrium. These two are useful in assessing severity. Another aspect which you can look at is the width of the jet at its origin, and also this flow acceleration before that mitral valve. That also can be looked at. As the mitral leaflets are thickened, this is likely to be due to rheumatic mitral regurgitation. And assessment of area for assessment of severity may be erroneous if it's an eccentric jet. This is not an eccentric jet, this is almost a central jet. But if the jet is going along a wall of the left atrium, sometimes it can go along the anterior mitral leaflet into the septal side, or it can go along the posterior mitral leaflet into the lateral aspect of the left atrium. When the jet is eccentric, the assessment of area for noting the severity may not be correct. It will underestimate if the jet is eccentric. But in a central jet, it's fairly reasonable. But color Doppler estimation of severity is mostly semi-quantitative. You cannot say it is highly a quantitative estimation. Here it is the AR jet. You can see the reverse flow into the left ventricle from the aorta with the aortic valve in closed position. This is a diastolic image, while this is a systolic image. Variance in color because of variance in velocity, and predominantly a red jet as it is directed towards the transducer. Here it is predominantly blue because it is directed away from the transducer. This blue flow could be the flow going towards the aorta in systole. In systole, aorta is not seen here because this is only a 4-chamber view. This could be the flow towards the aorta. Here, there is also a blue flow, but that cannot be flow towards the aorta as it is diastole. So most likely, this jet is going up to this and swirling around, producing a blue jet in the opposite direction, because as the aortic valve is closed and the regurgitant jet is coming in, and left ventricular diastolic pressures are lower than the aortic pressures. So this jet cannot go usually into the aorta. So this is probably a swirling around of the aortic regurgitation jet.